My name is Dr. Michael McCarthy of Sinel Specialist Hospital. I'm a specialist in uterine fibroids, fertility, and a gynecologist and obstetrician. Sinel Specialist Hospital is the place for managing these difficult conditions. Today, we want to speak about uterine fibroids. It's something that people talk about a lot, and also there are a lot of misconceptions. And so today, we want to give you some clear information about what this topic is all about. What are uterine fibroids? Uterine fibroids are benign or non-cancerous growths of the uterus. The uterus in the woman is the part of the body which carries the pregnancy, which carries the baby, and which is the seat of fertility. And that's where menstruation comes from, and so on. So it's a very important part of the body. And usually it works really well, everything goes nicely, and there are no issues. However, sometimes the muscle part of the uterus, the main part of the uterus, starts to develop what we call uterine fibroids. And these are round masses or oval masses that grow within the muscle of the uterus. And they are more like fibrous muscular tissues which grow in there. So basically, that's what uterine fibroids are. Who usually gets uterine fibroids is probably the question you've been asking yourself. Am I at risk? Could I have them as well? We'll get to how you know you have fibroids. But let's address the question, what are the kind of people who get uterine fibroids? It's a disease of women. So if you're a man listening, think about the women in your life and know that they are at risk. Some women are at higher risk. Obese women are more likely to be at risk. Women who have never been pregnant, women who have other women in their family who have uterine fibroids, because there's a strong genetic component to it where it's in the genetic makeup of the woman, and so there's a risk of getting it passed on from grandmother to mother to daughter. So basically, these are some of the risk factors, or the kind of women who get uterine fibroids. Maybe the biggest risk factor is being an African, and so it's more common in the African race than in the other races. And sometimes we see really multiple fibroids in one person. So that answers that question. The next question is, how do I know that I have uterine fibroids? And that's also a very important question, because you may be going through certain things in your body which could be symptoms of uterine fibroids, and you need to know about this. So one of the main things that uterine fibroids does is it changes the blood flow during your menstrual period. It usually causes an increase in blood flow. So when you notice that my periods are becoming heavier, they are becoming longer, sometimes there's even spotting in between the periods, and you just don't really get the pattern. All these may be symptoms of uterine fibroids. Sometimes the bleeding can be really severe. Sometimes you don't actually notice that the bleeding is severe, but on a lab test, it's noted that you have a lower blood level or anemia. That may be because you are getting heavier periods and it is affecting your blood level. The second symptom of uterine fibroids is pain. You may be having pelvic pain. You may be having pain during intercourse. You may be having pain during your menstruation, or even pain outside of menstruation. The next symptom that could happen is that you feel that there is something growing in your abdomen. There's a mass. There may be something moving in the lower part of your abdomen. When you touch your abdomen, you feel that there is something firm, or there's some resistance there. There's a ball-like mass or round mass growing in there. Or you may feel pressure on your bladder. You may feel pressure on the rectum. And these are all symptoms of uterine fibroids. Of course, there are other things that could make one realize this. It could be an ultrasound scan at maybe during early pregnancy and just notice that you have them, or you maybe went for screening and it was found, and so on and so forth. But basically, these are the common symptoms that uterine fibroids give. The next question is, so what do I do if I suspect that I may be having uterine fibroids? Well, the uterine fibroids equation always involves the gynecologist. You need to visit your gynecologist so that we can do a proper evaluation of the situation. We'll ask you questions, we want to find out what's going on, what has changed, how long ago has it changed, and so on. We are interested in your fertility history and your fertility plans, and looking at your age, check your body size and your weight, and so on. Of course, then we go on to do a clear physical examination to check and be sure what is going on and really see, so what's going on in the abdomen, is there a mass or not. We go on straight away to do an ultrasound scan, which is one of the best ways to see what is happening in the uterus. And that will give us our clear diagnosis. What tends to happen is that the uterine fibroids could occur in different parts of the uterus. And it's quite important to know which part of the uterus the fibroids are growing in. It could be on the outer surface, it could be in the inner, or it could be very much in the core of the uterus where the menstrual bleeding comes from. And these different locations will give you different kinds of symptoms and different kinds of challenges and problems that will be addressed differently. The question often asked is, Doctor, when is this fibroid becoming critical? When is it becoming dangerous? When do I need to get treatment, and so on? And I think every fibroid is different, every woman is different. The best thing to do is to come in as early as possible so that we can evaluate and let you understand what your fibroids are doing, what kind of plan is going to happen. And then we can show you exactly how to manage the fibroids. I have a lot of patients, they come, we want to do surgery, and I tell them, you don't need surgery, all you need is A, B, and C. And then we carry out those things, and then we just monitor these fibroids 6 months, 1 year, and so on. You don't have to wait to get into an emergency situation. You want to prevent some of these problems. And I think having a proper plan is the key to preventing some of these problems. We have been talking about uterine fibroids, and this is a very important topic that we need to understand because it's very common, it's very prevalent, and a lot of women have it, especially those who are a little older, above 35. But you can also have it in younger women, even in their 20s. So what do we do if we find out that a woman has uterine fibroids? In fact, most of the time, we don't need to do much. Sometimes the fibroids are really small, they are not causing any problems, and they are okay. We just leave them alone, and then we'll be monitoring them as we go along. Sometimes the fibroids are only causing anemia, and we may be able to treat that with medications. Sometimes there is pain, and we may be able to treat the pain. Sometimes there is increase in blood flow. We can manage that as well. Occasionally, fibroids may require surgical intervention to solve the problem. It could be in those who are planning for pregnancy and the fibroids may be interfering with getting pregnant or carrying a pregnancy, miscarriages and so on. And in those cases, we may need to go on and do some surgery to solve that problem. Some people have finished childbearing and the fibroids are causing problems, and so surgery again may be warranted. And there's some other treatments as well. But the most important thing is that when you come in, we will find out what is going on with you. We will check what type of fibroids and how the fibroids are located, what your symptoms are, what your plan is for fertility, and so on. And we will show you an exact plan on how you can achieve the best outcome regarding your fibroids. Don't think that, oh, every fibroid requires medicine, every fibroid requires surgery. No. We have to evaluate and give you that clear plan. And it's always rewarding to see a patient walking out of the consulting room really understanding her condition, no more worried and distressed about her condition. She has a clear plan. She knows what she's going to do this month and next month and the month thereafter. And so that's really, really important. Let's speak about some misconceptions about uterine fibroids. So people think that, oh, if you don't get pregnant, you get uterine fibroids. So either pregnancy or fibroids. No, it's wrong. Uterine fibroids are not necessarily formed just because you have not been pregnant. There are people who are pregnant who have uterine fibroids and so on. So that's really not true. It's because of some genetic makeup that you have, and that is why you have the uterine fibroids growing. Some people also think that, oh, we can take some medication and the fibroids will melt, and they will dissolve, and they will disappear, or they will shrink. Doctor, don't you have any medicine to shrink the fibroids? That's not how it works. The fibroids are not going to go away by just taking medications. They need to be managed according to a clear plan. I've seen people taking medications purported to shrink the fibroids, and the fibroids are rather growing bigger. So we need to understand the reality of it and manage them very appropriately and correctly. Some people also think that when you don't have your period and the blood is staying inside, then it causes uterine fibroids. No, the uterine fibroids are not blood. The uterine fibroids are tissues of the uterus, and they don't have anything to do with being formed by blood that is not coming out. That is a different thing. That's a blood clot. That could be something else, and so on. So I encourage you to seek proper help, seek professional help, and see how this problem can be solved. I believe that the fibroid issue is treatable. It can be managed, and we can help you to achieve your desired goal regarding fibroid treatment. In conclusion, I would like to open up Sinel Specialist Hospital to you. It's a wonderful place. We have wonderful doctors and nurses, and we are ready to draw up a plan for you and help you to achieve what you want to achieve. We also do surgery, of course, but we do a whole variety of different things. Surgeries, sometimes difficult surgeries, sometimes very simple surgeries, and so on. But I don't think surgery is the most important thing. I think the most important thing is to be able to understand you and meet your needs and draw the kind of plan that will actually serve you best. So thank you for your attention, and see you soon.